Hello everyone. Welcome to my channel Physiopath Education. Today we're going to study the MCQ pattern question answers, and for the MPT entrance examinations as well as the CBT for AIMS and state government physiotherapist recruitment. Okay, now in my previous lecture we have gone through the question number 10. Now we'll go to the question number 11 for this session. Question number 11: the delivery of rehabilitation care which involves single contact with a large number of rehabilitation professionals at the same time is number A, home approach, number B, camp approach, number C, outpatient clinic, and number D, daycare center. So here the main answer derives here. The delivery of rehabilitation care which involves in single contact with the large number of rehabilitation professional. Okay. Question number 11. Here the answer will be number B, camp approach. Why camp approach? In camp approach, many patients are evaluated or treated by multidisciplinary rehabilitation team in a single setting and time period. Commonly in community rehab program. Okay, here the answer will be number B. Here why not? So we'll see the other options. The answer will be the camp approach. Why not the others? Home approach. In home approach, in home approach, the rehab delivered at home, where you will not get not mass multidisciplinary contact. Okay, contact in outpatient clinic. Why in what will be in outpatient clinic? Here individual appointment. Not large scale professional interactions happens here, and in last option is the daycare center. in daycare center, continuous daytime rehab service, but no specifically camp style mass, but not specifically camp like mass contact. So that's why the answer for this question number 11, the delivery of rehabilitation care which involves single large contact number of rehabilitation professional, is the camp approach. Okay, so we'll go to the next question, that is question number 12. In sitting ergonomics, the height of the top of the workbench should be. In sitting ergonomics, the height of the top of the workbench should be. Okay, number A, at the height of the elbow of the workman. Number B, above the height of the elbow of the workman. Number C, below the height of the elbow of the workman. Number D, 10 centimeters above the height of the elbow of the workman. Okay, now we'll go to the question number 2, explanations. Okay, the correct answer will be number A, at the height of the elbow of the workman. Okay, so what is the basic principles or ergonomics principle behind this answer? So why the answer is the at the height of the elbow of the workman? Thus here look after the sitting ergonomics. In sitting ergonomics, the height of the top of the workbench. So with the basic ergonomic principle is the workbench height should approximately match elbow height during seated work. Why? To minimize shoulder elevation. Okay, why the height of the elbow, height of the top of the workbench is above the height of the elbow to minimize the shoulder elevation and trunk bending. Okay, so this is the basic ergonomic principle. The answer will be the at the height of the elbow of the workman. Okay, now next question number 13. During community camp, a mother has recently been re-informed that her child has Down syndrome. Okay, look at the point, Down syndrome. You will be evaluating the child in the afternoon. Which of the following characteristics is not associated with Down syndrome? Not associated. Down syndrome not associated. You have to find out which one is the not associated. So answer for question number 13 is, see, simian crease, brachycephaly, oily skin and hypotonicity. In Down syndrome, commonly present will be the simian crease will be present, brachycephaly will be present, and hypotonicity will also be present. So what will not associated is the oily skin. Number C, oily skin. In Down syndrome, skin is more commonly dry and rough, not oily. Next question, question number 14. Providing home delivery meals to people of any age who are having difficulty preparing nutritious meals for themselves is known as. Basically, it is a community rehab based question. The answer will be what are the options? Residential home meal, home delivery, that will not be residential home meal, halfway home meals. The answer will be the number C, meals on wheels. Okay, question number 14, answer C, meals on wheels. It is a community based service that delivers nutritious meals to elderly, disabled or dependent individual. Okay, next question is question number 15. Role of physiotherapist in industrial set up involves of progressively graded conditioning exercises that are based on the individual measured tolerances to restore physical, behavioral and vocational function, that is called as. Okay, the answer will be of question number 15 is number B, work hardening program. So answer of question number B is work hardening program. Why the answer will be work hardening program? As it is highly structured, individualized, goal oriented, okay, and it restores the physical endurance. Work hardening program. Okay, physical endurance, restores the behavioral tolerance as well as the vocational capacity. So that's why the role of physiotherapist in industrial set involve progressive graded conditioning exercise that are based on the individual measure tolerance. Okay, see, individual measure tolerance, behavior individual measure tolerance to restore physical behavioral, okay, and vocational function, that is the work hardening program. Next, question number 16. Early intervention programs are usually required to use a development test which is standardized and comprehensive. Early intervention program, okay, that are usually required to use a development test which is standardized and comprehensive. The best choice for you to use for motor development testing, okay, would be, what will be the best motor development testing? That is the answer C, Peabody developmental motor scale. Okay, that is the Peabody developmental motor scale. What is the Peabody developmental motor scale? That is specifically designed to assess gross motor skill, fine motor skill, reflexes, locomotion, and object manipulation. So why will be the answer will be the Peabody motor developmental motor skill? For early intervention program, usually for motor developmental testing, that it will be standardized and comprehensive. Why not the others? The others are the Apgar scale. APGAR. What is Apgar test? That is the assess newborn condition immediately after birth. What will be assessment of heart rate, respiratory rate, tone, etc. That is not for developmental motor testing. Okay, that is the Apgar is the assess newborn condition immediately after birth. What will be assess heart rate, respiratory rate, tone, etc. Mcqs scale does not assess developmental motor testing. Now next one is the Denver developmental screening. Why not Denver 2? Denver developmental screening test. It is the screening tool for overall development. Okay, overall development, not only or you can say it is less detailed for motor analysis. And last one is the Brazelton neonatal behavioral assessment tool. In the name is the behavioral. Okay, that will be not the motor developmental. Brazelton. Behavioral assessment scale that evaluates neonatal that assess neonatal behavior and response, not the comprehensive motor development. Okay, so next we'll go to question number 17. As a perspective and approach for fitting the organization into the person or persons within that organization is known as. You have to study thoroughly. As a perspective and approach for fitting the organization onto the person or persons within that organization, that is known as the macroergonomics. Okay, normally macroergonomics deals with the organizational structure, work system, socio-technical system fitting within the organization workers. Why not the answer will be the microergonomics? Because the microeconomics normally focuses on the individual workstation, not the person's individual workstation. Okay, why not it will be the organization ergonomics, not the standard terminology used in the ergonomic. It is not the standard terminology. Number 4, that is zero ergonomics. That is not recognized concept in the ergonomics. Normally the microergonomics and macroergonomics are the recognized one. Okay, so why it will be the macroergonomics that deals with the organizational structure or work system and fitting the organization to workers. Next one is the number 18. Among the below mentioned list, which act is not a national act for disability formed by Indian government? First of all, mention which act is not a national act for disability formed by the Indian government. Okay. Question number 18. See, first of all is the Mental Health Act 1987. The number B, the Rehabilitation Council of India Act 1992. The Person with Disability Act 1995. Number D is the United Nations Convention on the Rights of Person with Disability. Automatically, the United Nations Act will not will be the Indian Government Act. The easy one. Okay. Number D. Next one is number 19. An expert in the field of public health is required to estimate the magnitude of a health problem. Which rate would be calculated for this? Okay. An expert in the field of public health is required to estimate the magnitude of a health problem. Which rate would be calculated for this? The answer will be the prevalence. Number B. All these questions are coming from the ergonomics and epidemiology. Okay. The question number B, 19, answer will be the prevalence. Why? In epidemiology, the prevalence measures the total number of existing cases. The prevalence measure the total number of existing cases in a population at a given time. Okay, so it reflects the magnitude. Okay, so here it reflects the magnitude or burden of a health problem. Okay. Next, question number 20. A woman bring her child to the hospital for Mongolism. The possible agent of the disease that comes in your mind is possible agent of the disease. So, question number 20. In Mongolism, there is in Down syndrome, the older term is the Mongolism. The Down syndrome older term is Mongolism. So the Down syndrome occurred due to chromosomal fracture. So Mongolism is directed to chromosomal fracture. So answer will be the answer C, the chromosomal factor. Okay. The Down syndrome, in Down syndrome, it is caused by the trisomy. You know, all know trisomy 21. What is trisomy 21? It is extra chromosome 21 due to chromosomal non-disjunction. Okay. Next answer will be the chromosomal factor. Next question, on National Immunization Days against polio, the vitamin given along with the polio vaccine. National Immunization Day against polio, vitamin given along with the polio vaccine. You know that correct answer will be the vitamin A. Okay. During many public health immunization campaign, the vitamin A supplementation is given along with the OPV, oral polio vaccine. Okay. During many health immunization program, you will see in the health centers, the vitamin A supplementation is given. Why? During to reduce the childhood blindness, that's the main, and improve the immunity, reduce the morbidity and mortality rate. Okay. Or vitamin B complex or vitamin C or vitamin K that are not routinely combined with the polio campaigns. Okay. And vitamin K is specially given to the newborn to prevent the bleeding disorders. Okay. So the answer against on the National Immunization Day against the polio, the vitamin given is the vitamin A. Next one, number 22 is the which one of the following is a live attenuated vaccine? You will know live attenuated vaccine is the 7 vaccine. Okay. It is the 7 vaccine. Why? You will know 7 vaccine is also OPV. It is the OPV, which contains live attenuated poliovirus. Okay. Another options are the Salk vaccine. What is that is the inactivated polio vaccine. Salk, it is the live, it is inactivated. Salk is the inactivated, or you can say die or killed polio vaccine. And next one is the cholera, that is traditionally always the killed or inactivated preparation. And last one is the diphtheria toxoid, that is the toxoid vaccine, not live vaccine. So here the live vaccine only one is the Sabin vaccine or OPV. Okay. Next question number 23. The estimate of the average number of additional year a person could expect to live if the age specific death rate for a given year prevail for the rest of his life is expressed by. Here options are the cervical index, life expectancy, age specific death rate and crude death rate. Here normally estimate of the year number of additional year of a person could expect life is determined by the option number B, life expectancy. Okay, what is the 23 options? B, expectancy. What is life expectancy? It is the average number of years a person is expected to live. If current age specific mortality rate continue. Next question, question number 24. In a research study, the results are considered reliable. Considered in a research study, the results are considered reliable. That means, this means, okay, this is a question of the research methodology chapter of BPT. Okay, research methodology. So in a research study, the results are considered reliable. This means it was conducted by a reputable researchers who can be trusted. What answer? The measure devised for concept are stable on different occasion. That is the correct answer. Reliable. Why? The measures devised for concept are stable on different occasion. Question number 24. Answer is the B. It is one of the question of the research methodology. What is reliability? Okay. Research in research methodology, reliability is known as the consistency or stability of measurement. And reliable tool gives similar result on reputed testing under the similar conditions. Okay, so the answer will be the reliability. The next question, question number 25. Sampling error can be reduced by all of the following concept. The options are the number A, by stratification, number B, increasing the sample size, number C, decreasing the sample size, and number D, by proportional allocation. Okay, question number 25. The answer will be by decreasing the sample size. What is the question? The sampling error can be reduced. How will the sampling error reduce? The sampling error reduced when the sample size increases. Okay, the sampling and stratification is used. Stratification is used, increase the sample size. And number C, proportional allocation. So sampling error can be reduced all of the following except by decreasing the sample size. Okay, so here are the questions and answer and its justification for today's class. We'll see you in the next episode. Thank you.